Meanwhile, a boost today for primary care in Essex County from the provincial government. The Essex County nurse practitioner-led clinic in Kingsville is able to expand and take on more patients. CTV's Chris Campbell joins us now with more on this tonight. Chris.
Yes, Stephanie, officials in Kingsville say this is just one more step towards closing the health care gap in Essex County and ensuring more people have access to consistent primary care.
Provincial officials announcing funding Thursday morning for the Essex County nurse practitioner-led clinic in Kingsville.
Primary care is the best way to keep people out of the emergency room, and that's why we are focused on getting primary care to everybody in Ontario.
The undisclosed dollar figure on this second stream of funding is a follow-up from last year's announcement of more than $424,000 in February of 2024 to allow the TMC Urgent Care Clinic on Main Street to expand.
There was a huge need in this area, so we were successful last year with the announcement to roster 1,200 patients.
The investment, part of a larger provincial initiative to connect more people to primary care teams.
And now with this new announcement, we are able to roster an additional 800 patients who are able to have access to this full gamut of care within our clinic.
The clinic's team says this is permanent support to help patients who don't have a family doctor to get primary care, a growing concern, especially in rural communities.
They're the best. They're the absolute best. I broke my kneecap last year by accident, and it was the nurse practitioner who knew that I had a blood clot when I fell, and that, I think, saved my life.
That's great. That is great. And this is good. It's good to be in Canada, and it's good to have the medicine here.
When you have great partners to work with, you can make things happen, and that's why we now have 2,000 more people in and around Kingsville connected to primary care.
This follows news from Erie Shores Healthcare in Leamington, which unveiled a new primary care referral pathway on Wednesday.
And so this is a really important point where when patients are discharged from the ER or discharged from an inpatient unit or our admission discharge unit, that we're attaching patients to the nurse practitioner-led clinic in Essex and or through WeCHC in real time. And that's allowing us to minimize revisits to the ER or readmissions as well.
Together, both initiatives aim to strengthen the local healthcare network, keeping more residents connected to ongoing care and reducing pressure on local emergency rooms.
Nurse practitioner-led clinics are part of the solution to providing greater access, especially as patients are leaving hospital or leaving emergency departments or trying to avoid an emergency department visit.
Officials say partnerships between hospitals and community clinics are the key to improving access, especially in areas struggling with doctor shortages. And they note the team in Kingsville can start rostering new patients up with the nurse practitioner immediately. Stephanie?
Exciting. Okay, Chris Campbell tonight. Thank you for this. So for our question of the day, we want to know if you have a family doctor. Go to our website to cast your vote, ctvnewswindsor.ca.